We're going to go ahead and get started. Good day, everyone. Thank you for joining us for our COVID Update 13 on post-COVID-19 use of AI to improve practice performance. My name is David Means, and I'm the Director of Marketing at PlanetDDS. For those of you who are not familiar with us, PlanetDDS was founded in 2003, and we were first to the cloud with our enterprise practice management solution. A few housekeeping items before we begin. If you have any questions, please type them into the questions module within GoToWebinar's control panel, which should be on the right side of your screen. We'll answer as many questions as we have time for. Today's session is being recorded, and we will send everyone a link to the recording after the webinar. And now I'd like to introduce our presenter, Brian Colao, Director of Dykema's DSO Industry Group. Brian, I'll turn it over to you.
Thanks, David. Hello, everybody. Here we are, installment number 13. Really starting to get really excited to be here. You know, when we started with installment 1, it was sort of a crisis, and I was happy to be here, but it was sort of, very difficult circumstances. Now I'm really excited, to kind of be here because the dental offices are opening. Most of them are open, in fact, and I'm going to talk a little bit about that in a second. But this is really an exciting time, and it's my pleasure to be here as we start to, the dental industry really starts to gain steam again. First, I do want to thank PlanetDDS. They have now sponsored 13 of these. So thanks again to PlanetDDS for allowing us to have this platform and to provide all this information. We've got a great panel today. Before we sort of get to that, I've listened to the latest update from the ADA Policy Institute. It was pretty interesting. As of June 1st, 2020, a few statistics, 90% of the offices are now open. And most of the 10% that are not open is either a personal choice where that individual dentist still doesn't feel comfortable, usually a solo practitioner that has made a choice, they just don't want to open, or a few instances where there's still some PPE issues. But other than that, 90% of the offices are open. Nationally, if you're wondering, the offices are just as an average. There's a huge variation here, but as an average, it's 53% pre-COVID, production levels. But that's really misleading because I don't know any offices that are at 53%. It seems to me 29% are reporting business as usual. A few that are just starting to open in some hard-hit areas are, lower than 53% as they gradually start to ramp up. But it seems like at least close to a third of the offices are business as usual and almost at pre-COVID levels. There's a whole bunch hovering near the, 60, 70% range. And then there's a minority that's much less than that. So nationally, you get an average of about 53%. Staff are being hired back very, very rapidly. And I think the fact that Congress extended the time on the PPE program or the PPP program to spend the money, they're giving everybody, I think, I don't have it in front of me, but several more weeks than they did. I think it's almost to the end of the year. And because of that, the staff are coming back very rapidly. Overall, dentistry led healthcare in rebounding with the economy. 10% of the new jobs or the jobs added back to the economy were in dentistry. I think that's a tremendous statistic. Dentists are not being hired back as rapidly as staff, and that's not surprising. They're more highly compensated, and in those offices where the demand hasn't come back yet, they haven't quite hired back the dentist as fast. The PPE supply situation appears to have dramatically improved. I don't have any precise statistics, but what the ADA says is it's dramatically improved. Where there were, just widespread shortages just a few weeks ago, it seems to have dramatically improved. Of the 10% of the offices that are closed, 7 out of 10 of those, so 70% of the 10% are going to open by the end of June. So we're going to probably just be down to, I'm not great at math, but we're probably going to be down to something like 3% of the offices that, by the end of June might still be closed. So we're going to be up to around 97%. For some reason, they reported 7% of dental offices have dropped Medicaid post-COVID. I'm not sure what to read into that statistic, but that's one that they were reporting. They also conducted a poll of patients, and the public, these are very good statistics, deems returning to the dentist a high priority. They don't seem to be identifying significant fears surrounding returning to the dentist. You know, in May, there still seemed to be a little bit of fear around it, but here we are in June, and most of the public seems to have no reservations based on the polling conducted by the ADA to return to the dental office. Hygiene is a little slower than regular dentistry. Probably, you know, there's two reasons that are listed there. Some of the hygienists are a little hesitant, you know, to come back. And obviously, hygiene at least still is considered to be, you know, possibly a little more risky than general dentistry by the general public. At least that's what's being reported. Of course, those that have listened know I had my personal dentist on here 2 weeks ago, Dr. Lohman, and she reported her experience. I reported my experience of going back to the dentist, and you know, I felt safe. I felt like there were adequate precautions. So hopefully, we'll see a big uptick in hygiene the next time, you know, we give this report. But anyway, that's sort of a status of what the reopenings look like right now. At this point, I think I want to announce our guest today. I'm really, really excited. Very good friend of mine. We have Amol Nirgudkar here. He's the founder of Patient Prism, pretty much the leading authority for artificial intelligence for the dental industry. He's a good friend of mine. I'm really excited to have Amol here. Amol, let's do a quick sound check. Can you hear me?
I can hear you well, absolutely. Thank you for having me.
Well, look, I'm really excited that we have you here. There's been a lot of demand for this presentation because everybody wants to hear about artificial intelligence. You know, when we had our conference in Dallas last July, you know, everybody knows, unfortunately, it's canceled this year. But when we had it last year in July, we had 804 people, and they all were asking me about your presentation on artificial intelligence, and I still continue to get it. I mean, I thought it was like, you know, the Terminator and the supercomputer, but you've really kind of figured this thing out. So let me start. We got plenty of time to kind of go through everything. So let me start from the very beginning, if I can. When we say artificial intelligence, I think it's the Terminator, and I get all excited, but you've corrected me on that a bunch of times. You said the Terminator is not going to get us. So what is artificial intelligence?
You know, artificial intelligence the term has come about recently in business because we hear about it a lot, but it's been around for a very, very long time. In fact, the term was coined in the 1950s. And really, artificial intelligence is nothing more than the science of data. And what it means is that every time you know, a human brain has only so much capacity to analyze data, but a machine with the right power and the tools has almost an unlimited capacity to handle data. And because it does have that, it can make some predictions that a human being cannot do normally. So that's what AI is. AI is an attempt for a machine to replicate, eventually, hopefully one day, to replicate what thousands and millions of humans would do using a machine and make more intelligent predictions that a human would not be able to come up with on their own. That really is the foundation of it. But at the end, at the very foundation of AI lies a prediction. Can we predict something about whatever data we're looking at so that we can serve whatever audience that we're serving in a much better way?
No, and that's really, really helpful. And tell me, what are some common usage? You had a great presentation that I saw. I think it was with, I don't remember if it was Apple, but she was making a haircut appointment or something. But tell me, what are some common uses for artificial intelligence today, just in everyday life that people maybe don't even know about?
You know, when you watch, a lot of people have been watching Netflix lately, right? And Netflix uses AI for multiple ways, right? One, they use AI to figure out that, okay, if you've watched, let's say, House of Cards on Netflix, then it's going to automatically figure out that based on what you liked in House of Cards, it's going to automatically recommend the shows that you will like based on what your preferences are. There is no human being sitting at Netflix saying, oh, Brian watched House of Cards, so he may like this show or that show. So that's how Netflix has gotten a lot of people to watch more of their stuff over the last few years, is by deploying AI to figure out what people are doing, and based on that, predicting what they might like. Now, they have taken that even further in saying that, okay, if there are parts of the shows that people have liked, and Netflix has come up with ways to create new shows based on elements of shows in different. So there might be a show called Ozark that people like. There might be a show House of Cards. There might be another show. They would look at which episodes the human beings like the most and say, oh, these are the themes. The AI will figure out that these are the themes that people seem to like. They like action. They like violence. They like comedy. And they will combine those elements to create new storylines and new shows that will allow people to say, like, oh my God, I love this show because, and they don't even know that, right? It's behind the scenes. And that's one thing. Right now, Netflix has been in our neighborhood, in our households for the last 2 months. We have watched more Netflix than ever before. And they have used AI tremendously to not only recommend us the right shows, but also create new shows that we might like in the future based on what we liked before.
Yeah, and I know we could go on for hours. I mean, there's dozens and dozens of other uses. I mean, to me, it would be, I remember one time I was looking, before I understood all this stuff, you've been a great educator of me on artificial intelligence, but I remember my wife wanted to go to Iceland. And I remember I was looking online for Iceland, and then I thought I was reading the New York Post because, my New York Giants are kind of a lost cause, but I was going on there to figure out the Giants, and all of a sudden there's all these Iceland ads, like this weird coming up, come see Iceland, come go for a helicopter tour. And I'm looking at this and I said, I've never seen Iceland ads in the New York Post before. And it was actually tailoring ads based on what I was browsing earlier in the day. And that would be an example, right?
Well, it's sort of an example. It's not perfect. I mean, Facebook, so that's just in marketing, it's called retargeting. And it stores what you've seen before, and then it brings it up every time you go somewhere else. It'll show you an ad for Iceland. It'll show you ad for the gear that you would wear to go to Iceland. Companies like REI and all those people would show up and like, oh, this guy might be interested in hiking. You've done a Google search on hiking. Google's algorithms are going to figure out, okay, let's make sure we show Brian anything that is relevant to hiking ads, and that's how it can be only done in an automated way, and AI absolutely helps in that. But one of the ways people have been also using a lot of Facebook lately, and Facebook has done immense amount of work in AI. Whether it's politics and elections, whether it's giving us the preferences. So it may not even be that you are looking for something. So if you liked something on Facebook that your friend posted that had to do with a trip they took to Iceland, then the AI is going to figure out that, man, looks like Brian over there, they don't know you by name, might be interested in these kind of trips. So it's going to start thinking about what your behavior patterns are. And based on your behavior patterns, it's going to come up with a profile for you that's going to say, oh, Brian might most likely be interested in outdoor activities. And now all of a sudden, you log onto Facebook from Colorado, which we have a brand new house there. Congratulations on that. Now it's going to think, oh, Brian's in Colorado. And all these different inputs, right? Wherever you go, wherever you travel to, wherever you stay the most, it takes all those inputs from all different sources and comes up with an idea of who you are. Sounds a little scary, but it comes with the idea of who you are as a person, what you might like and dislike. And based on that, it's going to put you some preferences on your plate for you to eventually purchase or consume. And really, that's the power, right? Power of artificial intelligence is to really customize every human being's experience based on their specific likes that they like, and it's becoming both scary and powerful if you know as we go along.
Yeah, I mean, you can make the ultimate ads. I mean, right now, you know, for the last 10 years, people get inundated with a lot of garbage. They delete it. They don't look at it. They're like, I can't believe they're sending me this ad for, you know, I don't know, strength enhancement pills, or they're sending me a push-up machine. I don't care. But this thing will figure out what you really like and what you're interested in, and then it will start targeting those ads to you, and they're getting better and better at it, I guess, with the eye towards soon you'll only get stuff you're really, really interested in, and that's a more powerful ad campaign, it sounds like to me.
And that's only in business, but if you look at like Apple Music, for example, right? Apple Music will look at what is Brian listening to from a song perspective. And there might be songs, let's say Brian Colao likes jazz, right? And he only listens to jazz, and he doesn't listen to anything else. But now AI is going to figure out what are the elements of jazz that Brian Colao likes. And then if AI finds a song that is not technically coded as jazz, that not technically classified as jazz, but it has elements of jazz music, the tones and the runs. So then it's gonna put that song in front of you for you to listen to as a preference. All of a sudden, you're listening to something that's not technically classified as jazz, but AI figured out that based on the structure of the notes and the way it's played, it might be jazz, and you might like it. So now it's not even a business purpose. Now it's like, oh my God, AI could determine what music I might like in the future as well.
Yeah, this is really, really fascinating. And I know you and I have talked about this many, many late nights for hours, but this is, of course, a dental oriented program. So I guess, you know, I want to now transition this to, you know, you've gotten a couple patents. I mean, for an accountant, you started as an accountant, and now you've got all these patents in artificial intelligence. Let's talk a little bit about how has artificial intelligence emerged in the dental industry? And this was a big thing before COVID, and I know there's now more uses post-COVID, but let's start, you know, how are we seeing artificial intelligence deployed in the dental industry?
You know, I think if we go back a little bit, I think AI, artificial intelligence application in healthcare overall has been rising over the last 10 years. And dentistry obviously is part of healthcare, as we know. And really, the key in AI with healthcare at least has been, can we predict outcomes better? Can we diagnose diseases better? Can we determine the brushing habits of people better? Can we look at, and obviously in our case, can we look at conversations and understand what people want better? A lot of times what AI is able to do is take a lot of data that dentistry or healthcare produces. And then, you know, a lot of times when we think about data, we think about statistics, right? And statistics usually have to do with what happened in the past. And okay, what's the stats for this baseball player? What's the stats for this football player? And those are stats. But what AI is doing now is AI is taking those stats, and we call those stats hindsight. Hindsight is something that happened in the past that we can take a look at. But now AI is taking that hindsight, taking those stats, and really using that data to make a prediction about the future. And whether it is understanding of okay, this is the patient, for example. So I'll give you an example in dentistry where AI is being really used besides us. One of the big things in dentistry is diagnosis, right? People think about case acceptance and case presentation and diagnosis of dental disease or caries or cavities or whatever you may call it. And one of the applications of AI in radiologic imaging has been that could AI imaging diagnose disease better? Could they diagnose cavities better? Because they have looked at millions of those. And can they do it as equally good as a practitioner? So there are companies out there right now that are doing a phenomenal job in diagnosing and looking at X-rays and CT scans and coming up with, oh wow, we have diagnosed better sometimes even more accurate than a clinician. And that's going to be a great application, I think, going forward in AI. We've got toothbrushes. Obviously, there's a company out of England. There's an AI-driven toothbrush which recognizes your brushing patterns and understands that, oh my God, you forget to brush on this part of your mouth that's causing some problems in that area. Now, this kind of data is being collected as you brush your teeth, and that's going to be very interesting in terms of how we decide eventually to maintain our oral health. Obviously, we were the pioneers in this business in terms of recognizing conversational intelligence. What is that people want on the phone, and how do we understand that very quickly so that we're able to deliver the right communication so the patient decides to come into an appointment. So new applications are coming up there. We are the ones that are using it in conversational intelligence. There's toothbrush companies that are using it in toothbrush environment. There is radiology companies that are using it in diagnosing of diseases in dentistry, as well as using that diagnosis data to really present cases better, so that patients would say, all right, well, this must be accurate. So those are some of the applications right now in dentistry. I think robotics is coming. We've seen some robots come in and do place implants in patients' mouths, and those have happened. But I think that's still a new science. I think we're going to see more of that in the coming years.
Yeah, I met the CEO of that the AI toothbrush company. I think he was from the UK, if I remember correctly. And I thought that was fascinating that it studies sort of your brushing patterns, because everybody has been to the dentist or the hygienist and had them fuss at you about, hey, you're obviously missing this spot or you got to do this spot. Instead of waiting every 6 months to find out if you're missing a spot, this thing can give you real-time information on how you're brushing and how you're not brushing. I also have been following very closely some of the information with implants, where it used to be, that it was, you'd have to have a specialist, perform implants because, you don't know where the bone is. You'd have to very carefully figure out where the placement. I've learned a lot about, putting abutments in, and there's got to be enough bone. I know what all on fours are and things
right.
like that. And you got to be careful. But now there's some software that will aid and allow, some folks know exactly where they have to drill for the abutments. I also know that I met the CEO of that company with the x-rays, where they said they're better at diagnosing caries than the naked eye or dentist, or at least they say they are. I mean, I think you always are going to, under the regulations, them all have to have a licensed dentist sign off on the treatment, but at least the AI can help you catch things you might have missed, it sounds like.
Absolutely. I think there is a lot of opportunity, especially in hygiene, because, a lot of times, there's your patients are coming there for their regular cleanings, and and you're not diagnosing anything until it gets a lot worse. So I think AI is going to help us diagnose more treatment and eventually lead to more revenue, right? At the end of the day, if we're taking care of our patients and diagnosing things better and beforehand, we're gonna definitely detect and get patients to accept more treatment, because it's coming from an independent source and it's all data driven. It's not an opinion, but it's all based on science and data and facts. So absolutely, that it's definitely coming.
Yeah, it sounds like, I want to go through some other stuff, but it sounds like this stuff works. I mean, I was a little skeptical when I first heard about this, but the more I sit down with these folks, I mean, there's no denying that this toothbrush thing can figure out what you're missing and what you're not, and there's no denying that this analysis of x-rays really does a pretty good job of potentially catching things that some folks might miss. I mean, it seems like this stuff works.
It does. I mean, and there's a lot of very smart people, universities like MIT and Stanford, and many other big universities around the country have really spent a lot of time in healthcare AI. That includes the radiologic imaging of X-rays and CT scans. So there's a lot of push. There's a lot of private equity out there that's interested in this as well. because of the potential it has to grow the pie, grow the dental pie in ways that we had not imagined before. So really, in my view, Brian, AI has the opportunity and the potential really to bring more patients into the mix and do more stuff and dentists to do more things over the next several years and really grow the dental market from whatever it's $120 billion market. It could be really 5 times the size if we bring more people into the system and we're able to diagnose better. And there's nothing better today than AI to really leverage off of to get more patients in the system and more treatment being accepted.
Well, remember, 60% of the people don't go to the dentist to begin with. That was the status. That was the statistic pre-COVID. So the sky's the limit in terms of, when we have these shows week after week, Amol, and we go through all these various, business strategies and all these various, products and things on the market and vendors, we're talking about 40%, 60% don't even go to the dentist. So if we could tap into that, it seems like the sky's the limit on this stuff. It really does. But
I think so.
But let me ask you this, not to interrupt, but I want, you're getting all these patents. Like every time I see you on LinkedIn, you're getting a patent or something, and you're an accountant. I didn't know. So what are you getting patents on? Because I want to discuss a little bit about Patient Prism and what they're doing with artificial intelligence. So what are you getting patents on?
It's interesting, right? I mean, I was born and raised, not born, but I was raised as an accountant, and our industry is not known for, and we're really known to look at the past, but we're not really innovative in that sense. We're innovative in terms of, advising on accounting and tax strategies, but I feel I got lucky, right? We just wanted to solve a problem. The problem was that, patients were calling dental practices, and only half of them were actually scheduling an appointment with the dental office. And we felt that was a problem because here we are spending all this money trying to drive new patients into an office. And only if half of them are getting an appointment, then we're wasting all this money. And so we decided that, okay, well, what's the solution around there? And we're like, all right, we need to record these phone calls. And we realized that recording of the phone calls was not the solution, because again, if we record all these conversations and we employ somebody to actually listen to those conversations, it's too time consuming and nobody has the time. So our first patent really had to do with us visualizing a conversation without actually having to listen to it. It was a call called Cloudbased, and we developed a technology that visualizes a conversation between a call center agent or a dental receptionist and a patient, whereby you can visually see what went wrong during the call, what went right during the call that prevented that patient from moving forward towards booking an appointment. So really, we reimagined the whole idea of why do you have, nobody's got time to listen to conversations. We've got to be able to show them, because picture is worth 1,000 words. If you see what went wrong and see it very quickly, you can do it. So that was our first patent. We didn't realize we were this innovative until the patent office actually issued the patent to us. I'm like, oh, wow, we're innovative because, it looks like nobody else has thought of this before. So that was our first patent. And then eventually we got really into patents around understanding the keywords that the patients were talking about, and then correlating those keywords with what was happening on the call. So for example, we have a patent on a keyword cloud, a tool that allows us to understand that for an office, okay, how many patients of mine called us last month who were in pain and were looking for an implant? And so we developed technology for us to extract the right keywords from the patients and then correlate those keywords with whether they were able to book an appointment or not, with the intention that we need to do a better job of really having better conversations with our patients based on what they specifically like or not. So our patents have been really regarding understanding of the customer better, visualizing that data better, so that dental offices can quickly and expediently get back with that patient and put them back in the chair.
Yeah, because if I understood this historically, you can tape record your conversations. You got to tell everybody, you know, this call may be recorded for quality assurance, you know, and anybody that's tape recording out there, you need to do that. There's laws that say you got to tell people you're tape recording, but you can do that. And then I guess you can have some poor employee listen to like 9,000 hours of, you know, of tape or whatever it is, and then try to take notes. And you would literally almost have to have a full-time staff just to listen to recordings to critique the people that are answering the phone, or, you know, but it sounds like there's technology out there that'll do that for you. It will. And I remember from other times we've spoken to Amol, it seems like it will automatically listen to the recording of somebody that answered a call. And if there are things you wanted them to say as part of the conversation, like, you know, do you have any insurance I can check on for you? Are you in pain? Do you want to schedule an appointment? You know, other things that are critical that, you know, when you have your staff and you're like, you know, you're the owner, and you said, when my staff answers this phone, I want them, 1, to figure out if the patient's in pain, 2, to figure out, you know, if, you know, what their insurance is, 3, to ask them if they want to make an appointment. And those are critical things that you want to have happen. You can have the AI screen the call for those things and can tell if the call is going according to the way you want it to go per your training or not, it sounds like.
Yeah, absolutely. I mean, the ultimate intention is to put more patients in the chairs so that the schedule is full, so the plane is flying. If a dental operatory or a dental office is like an airplane, the ideal situation is you want that airplane so that to be filled with all the customers that are sitting in each operatory, getting the most amount of treatment for the time that they are in there, right? So that's the ultimate objective of an airline. You fill the plane with seats that are the most profitable to you, and so in our business, our job is to get the new patients in the door so that we're filling up your airplane seats, your operatories, with the most profitable patients, so you can, you know, obviously drive financial performance.
And I know you studied this, so walk me through it, just because, you know, I know you've studied it in detail. How does making sure that the folks that are answering the phone are doing what they're supposed to, that there is a direct correlation between that and case acceptance or people making appointments? Help me with the linkage there, because I know you've studied this in detail.
Yeah, well, I'll go back a little bit. So that the area that we're dealing with of AI that we operate in, and most people can think about this, that area is called natural language processing. And it's a branch of artificial intelligence that deals with the interaction between computers and humans using natural language, right? So the ultimate objective of natural language processing is to read, decipher, understand, and make sense of the human languages in a manner that is valuable to the end user, whatever that is, right? So now when you have Alexa or Google Home or Siri, you ask them the question, the underlying technology behind Alexa and Siri is natural language processing to understand human speech, convert that into some sort of a zeros and ones, and then come back and translate that back into human speech again, so that we can make sense, and that's valuable to us. So I'll give you an example of how we do this at Patient Prism by deciphering what happens. So let's say you're a patient, you're calling your dental, let's say you have a toothache, and let's say you may need an extraction, and you've had an extraction before, so you have a hole in your mouth and you have another toothache that needs an extraction. You call and you're on your way to work, and you stop at a stop sign, and obviously the stop sign is long, so you're Googling that, hey, best dental implant dentist in Dallas, right? And then you find a bunch of people, and then you call saying that, hey, I have an extraction. You call at 9:30 in the morning, and the conversation goes like, hi, I'm Brian. I live here. I've had an extraction a few months ago. I have another tooth that's hurting. It might need extraction. And the receptionist says, okay, wonderful, come on in. It's going to cost you $1,000 or whatever, $500. And then you ask, like, hey, I might need an implant here because I've really not thought about what to do in there. That hole is bothering me. I need to chew better. And the receptionist then tells you that, yeah, we do implants, and it costs you $5,000 a piece. That's about $10,000. and then the extraction is $500. So all of a sudden you're scared, right? And you 5-minute conversation says, all right, I'm going to think about it, and I hang up the phone. That conversation is recorded by us. It goes into the first thing that happens with it. It gets transcribed by our machines so that we understand what Brian wanted and what the receptionist offered. Once we understand that, the machine then determines, oh, Brian was a new patient and Brian wanted implants. Those implants plus extractions, the value of that is $10,500 because we utilize your fee schedule to map that out. So I know the value of Brian's phone call right now is $10,500 really quickly. Then the machine figures out from what you have said on the phone that you decided not to schedule an appointment. And we have trained the machine to understand who books and who doesn't book. Now, if the machine figured out that we lost this $10,500 opportunity that Brian called, in about 30 minutes from the time you've hung up, the machine, along with our human coaches that sit in Tampa, send an alert out using our patented technology called call visualization back to the dental office via email and by text, saying that you guys lost $10,500. Here's where you messed up on the phone. Here's what our machine has determined. Here is some training that our machine recommends you take before you call that patient back and try to get them on the second try, because that's a lot of money, $10,500. And so that's it. The science is understanding who is calling my office, whether it's a new patient. If that new patient did not book, then I want to understand what went wrong, what the value of that appointment was, so that I can deliver a great visual feedback back to the DSO, back to the call center, back to the dental office, so they don't have to listen to any of it. They can tell within half an hour, man, we better call Brian and better offer him some financing options through Care Credit or Green Sky and say, hey, Brian, you called us earlier and we can get you in. We've got the best system in the country. We've got one of the best doctors out there. We would love for you to see you back. And let's give you a free exam and x-rays and bring you back and give you that second chance to make that first impression and bring revenue back that you had lost just a half an hour ago.
You know, that's the part I think I forgot when I started, talking to you about this a few minutes ago. You can make real-time course corrections. I mean, obviously, you can train the staff. I mean, it seems like there's two opportunities. If the particular staff member that was talking to the patient didn't do what they were supposed to do, you'll know about that. And you definitely have either a training opportunity, or if that staff member is a complete lost cause, you could probably get rid of them and get somebody else trained and in there. But the part that I think I forgot about, and I'm glad you just covered it, is you can make real-time course corrections before it's too late. Like if that patient called a half hour earlier and for whatever reason, whatever was said did not result in that case acceptance, that's not necessarily a lost cause, because you found out about it quick enough that you could call that patient back and try to salvage the case, it sounds like.
And it's massive, Brian. I mean, we did a study recently, right, and I know you're going to ask me a question about this. So
I want to hear about because I know you've got the case. Tell us what that means to the average office in terms of lost cases and the opportunity to get a second bite at the apple and take a second shot at it.
Right, and so we've done studies with DSOs, small and large. On an average, we found out that almost 22 to 25% of those patients decided to come back on the second try. And 20 to 25% of patients, let's say you get 100 new patient phone calls a month in your office, and let's just assume that 50 of them don't schedule, and we send you 50 alerts. If 25% of that, almost, if we are able to get back 12 to 13 new patients a month that are of the right kind, well, whatever that kind is. We know what the value of a customer today is, what value of a patient is, right? It's anywhere between, $1,000 for the first year. A lifetime value is $25,000 to $30,000. That's lifetime value. But if I can add, without spending a dime extra on marketing, if I can add 10 to 12 new patients per office per month, that's a significant amount of revenue. that could come in, and depending on what your call volume is, we could bring back 25%. We've had DSOs that are as high as 35% in terms of bringing those patients back, because they are interested. Obviously, the way you're able to course correct is, sir, you called us half an hour ago. We forgot to give you some information. Let's give you some additional incentive for you to come back. And the quicker these practices or DSOs are calling these patients back, the more interested they are in coming back. And it's free revenue, right? It's the cost of acquisition all of a sudden for that patient became a lot lesser, because you don't have to spend an extra money on marketing to get that patient. You already had that patient in your lead, in your funnel. You just have to get them back, and people are coming back.
And but correct me if I'm wrong. This isn't just for DSOs. I know you've done a lot of research with DSOs, but this works with solo offices. It works with any dental office, right?
Absolutely, it works with every dental office that has a growth mindset, which means they get new patients, right? If you're a dental office that doesn't get any patient calls, obviously it's not going to work for you. But any dental office, whether you're one office, you're 150 offices, you're 1,000 offices, if you are actively looking for new patients and you're advertising out there to get new patient phone calls for whatever you do, implants, ortho, Invisalign, whatever that might be, if you're that kind of practice and you're spending money to drive new patient growth, this is going to work for you. It doesn't matter what your size is.
And how complicated is it to set something, like this up? Obviously, whatever, I'm going to make my Terminator supercomputer joke, whatever supercomputer you have, you've got to somehow sync it up with the practice's phone calls. Like, how much coordination or how long does that take, or what does that involve?
Yeah, it's really not. I mean, we're called, we are a cloud-based platform, just like Denticon is. We're completely cloud-based, so there's nothing to install on anybody's machine. It's all cloud-based, and we are able to integrate pretty much with every telephone company out there that exists in the universe, except unless you got the rotary phones with that you're dialing them round and round, those things, then it might be tough. But most people don't have those phones anymore. We're able to do all this stuff within a couple of days. Now, if you have sophisticated call center operations and you have some numbers that need to be ported over, that might take a little time, a couple of weeks, because it's the numbers that you have to port over. But the system is very seamless, and we onboard between 50 and 100 new clients every month, and it doesn't take more than a few days just to get it all going, because there's nothing to install. It's all on the cloud, just like PlanetDDS does with Denticon. It really is very seamless. It doesn't cause a lot of hassle on the side of the dental practice to kind of implement us.
And I know you've studied this, so I'm going to ask you about this too, because I'm just fascinated by it. What type of results have you seen in terms of, we've spoken, you and I, before about, where you've installed this in certain offices and, within a relatively short period of time, they've seen some results. I don't remember exactly what the statistics were, but do you remember what those were?
Yeah, of course. I mean, I think what we're seeing is on an average, it makes a top line impact on most practices. We're seeing results that range from $20,000 to $40,000 a month of extra production or extra collection, all the way. I mean, from 5,000 to 20,000 and beyond a month of new production, only resulting from those callbacks. Right now, we haven't even quantified the value of the training we provide to the front offices. And getting their first-time conversion rates even higher. So on an average, we look at between 10x to 25x ROI on what they will be doing with us, but anywhere between 5,000 to, we've seen all as high as 35 to 40,000 per month of added production or added revenue opportunities for each office. It all really depends on their call volume and how determined they are in actually using the data to call back those patients. Now, as you know, Brian, it's like in legal services, right? You can produce the most gorgeous documents, right, in the world to set up the best structures in the world, but if the clients don't really implement that structure and they follow that structure, just having the documents ready is not going to really help them in any way. Same thing with
Well,
us.
no, I mean, it sounds to me if they ignore all the alerts and don't call anybody back, it's not going to work. But that was going to be my question to you. What level of commitment or engagement is required by a DSO or a solo office or a practice? I mean, from what you've been telling me, it sounds like they have to be willing to read the alerts and call people back and try to get a second bite at the apple. But let me know if I missed anything. I mean, what type of engagement is required for this to be a success?
Well, the engagement is very simple. These alerts are not that many a day per office. So we expect to be there to be a Patient Prism champion, somebody who is responsible to, when they get the alert, to call the patient back, right, and give them an opportunity to rebook again. And that's it, right? At the very, we're not sending tons of data. It might be 1 or 2 alerts a day. It's not a lot per office. Sometimes it's 3 or 4 alerts a day. So you just have to engage in those conversations with those patients when you get the alert, and basically eventually the office manager can look at that stuff, or the regional manager can look at their data and see how their call center is doing. A lot of call centers around the country, they will look at how their teams are performing. Who is really good at doing what? Maybe Tom is really good at booking patients, but Jennifer is not as good. So understanding, using our data to understand who's doing better, who's not doing better, who can we train better. But at the end of the day, at the very basic, what we expect dental offices or call centers to do is to take the lead that we're sending you that's worth some money, and when you get that lead, re-engage with that patient, give them an opportunity to come back in. And that's it. It's not a lot, but sometimes I understand. One of the challenges we face is, and we know dental offices are busy, and there's a lot going on, especially now in the post-COVID world. Not everybody's back, and there's a lot to do. But when's the last time, Brian, you had a call from a brand new client and somehow you couldn't get to it? Your receptionist gave you the message that, hey, there's a new DSO that's being formed, and you you say, oh, I don't have time to call them. Have you ever said that?
No, I've never said that I don't have time to call them. Now, sometimes the day gets away from you and, you might miss a call here and there, but I've never in my mind said I don't have time to call them.
Right. And I think that's the key, right? And in order for us to understand that, and we have to really want that growth, and we have to have the capacity for the growth as well. And you may not ask me this question, but I'll kind of ask it myself. One of the things that DSOs and dental practices use us for is to sometimes understand what prevents a patient from scheduling an appointment. And sometimes it's not the receptionist. Sometimes we just don't have capacity. We don't have the providers. We don't have even enough opening hours on our schedule to book that patient within the first week. Because, as you consult hundreds and hundreds of DSOs across the country. And if you cannot put a patient on your schedule within a week, right, within the first few days, the patient's not going to come, right? You can't say I'm booked up till September, or I'm booked up till July and I don't have any appointments. So Patient Prism, using AI, we're able to also identify, are you having a capacity issue? Are you having a provider issue? Are you, and that way we can course correct that matter as well, right? Patient called in, want an appointment, want to come in tomorrow. I'm sorry, we don't have any openings for the next 2 weeks. And the patient wanted these all on 4 cases, $40,000 patient we can bring in because we've filled up our entire office with hygiene appointments, for example, that were missed from the COVID crisis, right? So we have to really understand. And so one of the things that we are really excited about right now as practices are coming back is to identifying those barriers that are preventing the good patients. The good patients is in patients who want to spend money with you, that are preventing them from making that appointment. And we're identifying them on an hour-by-hour basis.
Well, that's the issue. That's what I was going to ask you about. I mean, how can we use this post-COVID? Because, I think I pretty much understand, pre-COVID, and maybe a lot of it's the same, because honestly, if you heard them all, those ADA statistics, that the practices are ramping up, and at least 29% of the offices are business as usual. So maybe there's no such thing as pre-COVID for 29% of the offices, but for the other, 71% of the offices still have capacity and still are trying to ramp up and recover recover their revenue, recover their volume. It would seem like, there would be some uses for this.
Oh, absolutely. I mean, I think the story of COVID has been interesting, right? A lot of people thought that dentistry is going to be, dangerous place to practice, but there is no evidence yet worldwide that people have contracted COVID in a dental office. And there is some here and there, but for the most part, dentistry has been one of the safest professions that has existed. Dentistry uses more PPE than any other professions except surgeons who are operating in surgical rooms. Dentists use the same PPE. So what we've learned in the last month or so, as practices have started opening back up, that the demand for dentistry is tremendous. Patients need dentistry. Dentistry is essential. And the key for us as we get out of this, and this might take a 6 months or maybe a year or 2 years for us to completely get out of this pandemic. The key is going to be to understanding where our leakages are. What leakages mean is, where are we missing these patients? Where are we having problems? And if we're having them on the phone in terms of scheduling, in terms of capacity, we need to really pivot very quickly and understand that maybe we need to send this to a sister location, or maybe we need to expand hours. Maybe we need to get people, because at the end of the day, our goal is to get back to normal production and really allow our industry to get back to 100% and even more, because that's the goal.
And what, we got a few more minutes here. I wanted to know, I think that's really, really helpful. And I wanted to also ask you about, what do you think the future is going to be? It seems like every couple months they just come up with innovations in some of this AI that just blows your mind as to how sophisticated and nuanced it gets. Where do you think, the stuff you've already described to us is pretty incredible, the stuff you've described over the last few minutes, but where do you think the next couple of years is going to go with this?
Every crisis presents an opportunity, right? And I think the DSOs or the dental practices, doesn't matter whether you're one practice or 100 practices, the guys who will embrace technology, the people who will embrace data, and the people that will embrace data to make better decisions about what they need to do, and really use this technology, not just for the sake of it sounding cool. AI sounds cool, but that's great. But what does it do for me? If I can take that technology, implement that in my practice, understand data better, understand my customers better, I think we can work on bringing that 60% of that country back into the mix, right? We can do that. We can also use AI. We have all this unscheduled treatment in dental offices all over the country. It's 60% of treatment or 70% of treatment that's not accepted. We can use AI to correctly diagnose and bring these patients back. We could literally, the next 10 to 15 years, could see a renaissance in dentistry where we're leveraging technology, leveraging data to diagnose better, to bring more patients into the system, where we can educate patients better on the oral systemic health, and really expand the size of this market. I mean, dentistry has merely scratched the surface right now. And I think the next 10 to 15 years are going to be golden. I think this pandemic might just be the catalyst for industry to reclaim or to really rise to where healthcare is, and make an impact. In the meantime, also make an impact on people's lives and their healthcare.
Yeah, I mean, the statistics that we're starting to see, they've been out there for a few years, but they just keep getting highlighted about the correlation between good oral health and good overall health, they're kind of staggering. I mean, I've had expert after expert, Amol. I know you're not a dentist, but I've had plenty of really chief clinical officers, chief medical officers, on this show. And they've all said over and over again, the correlation between poor oral health and inflammation, diabetes, potentially heart disease and other infections, susceptibility to other infections. So, I mean, it's pretty staggering that a lot of conditions, at least I'm convinced, in the country, poor oral health is exacerbating or adding to those conditions. So if we can get more people to the dentist and more people treated, I think the overall state of the health of, people in America is going to be a lot higher. I mean, at least I've been convinced by all the experts I've had that say this over and over again on the show.
And I really genuinely hope, and I care for this industry so much, just like you do. We've been in this industry for so long that most of our family, we consider family, is in the dental industry, right? Whether they're dentists, hygienists, assistants, CEOs, whoever it is. And I think our dentistry, and I challenge our industry to do a better job of communicating this to the American public, to our lawmakers, and explaining them that how essential and important dentistry is, so that next time this comes around, something like this, I hope not, we're out there promoting that, man, you need to take care of your oral health because it could reduce your immunity and it could maybe make you more susceptible to getting infections. So I really think our industry needs to rise up a little more than what they did during this crisis. I think the ADSO did a good job. I think ADA can do better in terms of advocating on behalf of the industry of the importance of it to the public and overall society at large.
Well, it's a good thing you mentioned that in the last 2-3 minutes of the program, because otherwise I would get wound up about this. I've gone on and on and on about how dentistry is essential, and I think it was absolutely outrageous that it wasn't deemed essential and they shut the offices down. But I'm limited in time. I can't go on my soapbox today. But let me do this, Amol. I've really enjoyed having you here and definitely missed being around you. Hopefully they'll let us, go to some conferences soon and we can sit down again and have a drink and talk about AI and a bunch of other things. But for our last, minute or two here, if people liked what they heard about your platform and about AI, how can they get a hold of you?
It's very simple. They can go to our website, which is Patient Prism, www.patientprism.com. We also have created a free academy for people to help us during the COVID crisis. It's Patient Prism Academy. You can Google it. You can Google either one of them, Patient Prism or Patient Prism Academy, but go there, schedule. There's a nice orange box there, schedule a demo and talk to one of our sales teams and see for yourself how impactful we are. If you want to reach me, you can email me at AMOL at patientprism.com. I return my emails most of the days. Sometimes if they go in the hundreds, then it takes me a little while to get them back to you. But absolutely, they can reach me by email. Subscribe to our social media, LinkedIn. Follow me on LinkedIn. Follow us, Patient Prism, on Facebook. We produce a lot of content, as you know, in this space. There's a lot of resources we have created for the industry to download on Patient Prism Academy at academy.patientprism.com and enroll for free.
Yeah, no, you've got terrific content out there. I mean, even if folks are not ready to invest in artificial intelligence now, they can go on your site. And there's just incredible content that you offer free to the industry. And I just love that about you. And really was my honor, Amol, to have you on the show today and sit down and chat with you. I wish you luck post-COVID as everybody, sort of picks up the pieces and moves on. But want to thank you just so much for being here. And I guess we'll turn it back over to you, David. I know we're going to be here again next week.
Yes, Brian, we sure will. So I encourage everyone to come back for our webinar next week. I'd like to thank Brian and Amol for a fascinating discussion. If you have any questions on Dykema or Patient Prism, you can see their website URLs here on the screen. Of course, we'd love to have you learn more about PlanetDDS and our practice management solution, Denticon, as well. Thank you again to Brian and Amol for their time, and I'd like to thank all of you who tuned in for your time and spending a little bit of your day with us. Hope you all have a great day and hope to see you on a future webinar. Have a good day.